Hello to everybody here from ELPA. This week is Rare Disease Week, and today we have a specialist with us, Dr. Yoram Menachem. He's a liver disease specialist at Sheba Medical Center in Ramat Gan in Israel and the director of the Liver Tumor Service. He's a specialist in internal medicine, liver diseases, including viral infections, fatty liver, chronic liver dysfunction. Dr. Menachem serves as the secretary of the Israeli Society for the Study of the Liver. He is specialized in diagnosis and treatment of hepatitis C, hepatitis B, fatty liver, and cirrhosis. So today he will be speaking about a very, very rare liver disease, which is called alpha-1 or AATD. Okay, so we're going to start. We have Yoram Menachem with us already. And first of all, Dr. Menachem, can you give us a general explanation of the disease, please?
Sure. Thank you for letting me speak to your ELPA organization. Actually, alpha-1 antitrypsin is a protein. Is a protein that serves as a protective protein in the liver. It protects against inflammation in the body. And if we have an abnormal alpha-1 antitrypsin in the liver, actually it can cause intracellular damage and chronic liver disease, even cirrhosis. Now, actually, we can measure the alpha-1 antitrypsin in the serum. And if we diagnose low levels or damaged protein, so we can diagnose the disease. This disease can cause a variety of liver involvement, starting from cholestasis, even in infants and toddlers. And we as hepatologists see it in adults as cirrhosis or chronic liver disease.
When do you see that it affects the liver, actually? What are the symptoms?
Actually, most of the patients are actually follow unremarkable childhood and adolescence time. So we usually diagnose it quite late. And the most abundant symptom is cholestasis. We can see it as an elevated transaminases as well, or even chronic liver disease with portal hypertension and cirrhosis. Usually, portal hypertension is in about 30 or 40% of the patients. So actually, most of the symptoms are elevated liver enzymes, cholestasis, and chronic liver disease symptoms.
And what treatments are available for this disease, such rare disease, you know?
Actually, treatment is enzyme replacement therapy. But unfortunately, it's available only for the lung disease because we cannot, until today, we cannot present it to the hepatocyte, to the liver cells. So only patients with chronic emphysema or chronic lung disease secondary to alpha-1 antitrypsin deficiency can have the enzyme replacement therapy. We, as hepatologists, try to do some gene therapy, to do some molecule chaperones, even RNA technologies to present it to the hepatocytes, but still, unfortunately, we don't have any treatment for the liver disease.
And do you treat I'm going to ask you another question about that. Do you treat the symptoms? How would you treat the symptoms for these people that have the disease?
Okay, so we treat the symptoms like every other chronic liver disease. It means that we try to prevent cirrhosis complications, and we treat the cirrhosis complications. We can try and give even also the oxycholic acids if it's abundant cholestasis, but not more than this. I mean, we don't have specific treatment for the disease. Of course, we share the treatment with the pulmonologist, and usually they treat the lung disease, but not more than this.
Is there anything that can prevent the progression of the disease?
Actually, every patient with alpha-1 antitrypsin and normal liver function, if we diagnose it early, We ask them to keep a normal BMI, body mass index. We ask them to consume alcohol with the recommended limits and not more than this. And it means that we try to prevent some other liver damage secondary to other causes. Now, if a patient has an advanced liver disease with alpha-1 antitrypsin, we ask them to abstain from alcohol. And actually, until today, no therapy is recommended to prevent the disease progression.
Does the disease run in families? Are there specific tests other than what you suggested earlier?
Okay, so actually there are many phenotypes of the disease. It means that there are a lot of severity classes. And the worst disease, of course, it occurs in homozygotes. Now, most of the patients are heterozygotes, which means they have only one gene involved, but it usually does not run in families, but we can see a few relatives or even siblings in some cases. Now, actually, the level of the alpha-1 antitrypsin and liver biopsy, together with this genetic testing, make the diagnosis, the combination of all three.
Will transplant cure the disease, or does it return in the new liver as well?
Actually, it's a genetic disease, so liver transplantation does not cure it, but only gene therapy can cure it, but still not available. Now, liver transplantation helps us to gain some more time. We give the patients new liver, so this is the effect, but not cure.
What other organs in the body are affected by this disease?
As I told you before, usually the lungs. It means that all persons with chronic obstructive pulmonary disease, poorly responsive asthma, C-ANCA vasculitis, or even bronchiectasis, we have to rule out alpha-1 antitrypsin deficiency. Usually the pulmonologists do it. And of course, alpha-1 antitrypsin deficiency relatives should be tested. So usually only the lungs are the main other organ involved.
Okay. And just to guess a summary of what you suggest, what you see in the future, whatever you can tell us and help us with that.
Yeah, actually, this disease is underdiagnosed disease, and it's very important that you decided to speak about it. We hardly see patients. We have a few. Every hepatologist have its few patients, but as a genetic disease, we cannot prevent it. Usually, if we recommend on healthy lifestyle, we can actually prevent some more damage in patients. We wait for the gene therapy. We wait for a certain drug that will be presented to the hepatocytes in order that we can treat it treat the liver disease. But unfortunately, still today, we don't have any specific treatment for this disease. The pulmonologists have a success because they prevent the worst cases of emphysema and chronic pulmonary damage. But we remain with the patients with cirrhosis and treat them like other chronic liver disease. Yeah.
Okay. Once again, I'd like to thank you very much for your time today, and thank you for your help. And let's see what we can do to find a cure for this disease and for everything else, and be here for all the patients.
Thank you for letting me speak. Thank you.
Have a good day.
Thanks.
Bye-bye.